Dr. Tabitha Cranie reveals how borderlines love in a simply intense way. Have you ever wondered why some people fall in love with an intensity that seems to transcend the ordinary? There exists a group of people who, when they love with a passion that consumes, transforms, and completely redefines the meaning of what it is to feel. Today we will dive into the universe of borderline love, a phenomenon that challenges our traditional understanding of relationships. Society has taught us that love should be balanced, controlled, measured. But what if I told you that there exists a way of loving that is pure intensity, where every heartbeat resonates like thunder, where every exchanged glance is like contemplating infinity? We are talking about borderline love, an experience that few truly understand. Imagine a person who, when falling in love, doesn't just like someone, but gives themselves completely, as if their very existence depended on that connection. It's a surrender so deep that it can frighten those who don't understand the nature of this emotional intensity. But is this a weakness or a unique way of experiencing love? Dr. Tabitha Cranie, a retired physician specialized in borderline relationships, observes that these people experience what she calls love at maximum volume. There is no middle ground, no lukewarmness. It's all or nothing. It's heaven or hell. It's the most intense experience the human soul can undergo. We live in a society that pathologizes emotional intensity, that sees overwhelming passion as something problematic. But are we losing something essential about human nature when we label this form of loving as sick? Perhaps the issue isn't the intensity, but how to deal with it in a healthy way. Borderline love isn't just an emotional experience, it's an internal revolution. It's when every fiber of being reorganizes around one person, when the entire world gains more vivid colors simply because someone special exists in it. It's a way of loving that challenges social conventions about normal relationships. Studies show that people with borderline disorder not only can love, but love with a depth rarely found in other contexts. It's a love that burns, consumes, transforms. It's not a lesser love, it's a different love, more intense, more real in its urgency. The question we should ask ourselves is not whether this love is right or wrong, but how we can understand and support it. How can we create safe spaces for this intensity to manifest healthily? How can we honor this unique capacity to feel without judgment? Today, we will deconstruct myths, understand the science behind this experience, hear real stories from people who love in this unique way. We will discover that borderline love, far from being a problem, can be one of the most profound and transformative experiences of human existence. Prepare yourself for a journey that will change your perception about love, about emotional intensity, and about the beauty that exists in feeling deeply. Let's explore together this fascinating universe of the human heart in its most intense and true form. Throughout history, philosophers and thinkers have tried to understand the nature of human love. Plato, in his Symposium, already spoke about different types of love, including eros, that passionate and intense love that consumes the soul. Curiously, what he described over 2,000 years ago resonates deeply with what we observe in borderline love. Psychologist Robert Sternberg developed the triangular theory of love, identifying three components: intimacy, passion, and commitment. In borderline love, we observe a hyperactivation of the passion component, creating a love experience that transcends conventional patterns of emotional intensity. Otto Kernberg, renowned psychiatrist and psychoanalyst, dedicated decades to studying object relations in personality disorders. His research revealed that people with borderline characteristics develop unique forms of attachment, where love manifests with primordial urgency, as if it were a matter of psychic survival. History shows us that great artists, writers, and thinkers throughout the centuries manifested characteristics that today we recognize as borderline. Frida Kahlo, with her overwhelming passion for Diego Rivera, exemplifies how this type of love can be simultaneously destructive and creative, painful and sublime. In literature, we find characters who love with borderline intensity. Heathcliff in Emily Bronte's Wuthering Heights, or Werther in Goethe's The Sorrows of Young Werther, portray this form of loving that consumes and transforms, elevates and destroys simultaneously. Classical psychoanalysis, through Freud and his followers, initially interpreted these manifestations as pathological. However, contemporary thinkers like Marsha Linehan, creator of dialectical behavioral therapy, revolutionized our understanding by proposing that emotional intensity isn't intrinsically problematic, but rather a different way of experiencing the world. From an anthropological perspective, cultures around the world have different perceptions about emotional intensity in love. Mediterranean societies, for example, historically celebrated intense passion, while Anglo-Saxon cultures tended to value emotional control more. Modern neuroscience offers us fascinating insights about why some people love with such intensity. Studies show that individuals with borderline characteristics present differences in amygdala and prefrontal cortex activation, crucial areas for emotional processing. The concept of limerence, created by psychologist Dorothy Tenoff, describes a state of romantic obsession that resonates deeply with the borderline love experience. It's that feeling of being completely absorbed by another person, where every gesture, every word, every glance gains monumental significance. Existentialist philosophy, through thinkers like Sartre and Beauvoir, explored the idea that we exist through the gaze of the other. For people with borderline characteristics, this ontological dependence manifests particularly intensely in romantic relationships. Martin Buber, with his I-thou philosophy, described relationships where two people meet in their totality, without masks or pretensions. Borderline love frequently seeks this form of authentic encounter, this connection that transcends the superficial and touches the core of being. Jungian psychology speaks about the concept of anima and animus, masculine and feminine aspects of the psyche that we seek in others. In borderline love, this search manifests with an urgency that can be both creative and destructive, depending on how it's channeled. Maria is 28 years old and recently discovered she lives with borderline disorder. When she falls in love, she describes the experience as being struck by lightning. It's not a dramatic metaphor, it's literally how she feels. Every message received provokes an explosion of endorphins. Every absence of the loved person generates an almost physical anguish. Dr. Todd Grande, clinical psychologist specialized in personality disorders, explains that borderline love isn't less real or less valid than other forms of love. It's just more intense, more urgent, more vulnerable to emotional fluctuations. It's as if the emotional volume were always at maximum. Recent research shows that people with borderline characteristics present hyperactivation of the sympathetic nervous system during intense love experiences. This means their bodies literally respond to love as if it were an emergency, with all the adrenaline and urgency that implies. João, a young 25-year-old artist, tells that when he falls in love, his creativity explodes. Colors become more vivid, music sounds deeper, words flow with a potency he can't explain. It's as if love activated all his senses simultaneously, creating a synesthetic experience of affection. The intensity of borderline love doesn't manifest only in romantic relationships. Friendships can also be experienced with this emotional depth. Anna, 32 years old, describes how her friendships are deep connections where she gives herself completely, creating bonds that transcend the conventional. Statistical data reveals that approximately 30% to 45% of people with borderline disorder maintain stable, intimate relationships. This demystifies the prejudice that they are incapable of loving or maintaining lasting bonds. In fact, when they find understanding partners, they can form extraordinarily deep bonds. The phenomenon of the favorite person in the borderline universe is a unique manifestation of this capacity to love intensely. It's not about emotional dependency in the pathological sense, but about a specific form of bond where one person becomes the gravitational center of the borderline's emotional world. Dr. Tabitha Cranie observes that the borderline relationship cycle, which includes idealization, devaluation, and reconciliation, isn't necessarily destructive. When both partners understand this dynamic, it can become a rich and transformative emotional dance. Neurological studies show that the borderline brain processes rejection differently, activating areas related to physical pain. This explains why relationship endings are experienced with an intensity that goes beyond the emotional, manifesting as real and tangible pain. Marsha Linehan's research on emotional regulation revealed that people with borderline characteristics aren't too sensitive, but rather possess a naturally more reactive nervous system. It's like having a more powerful emotional antenna, picking up signals others don't perceive. In professional contexts, this emotional intensity can be channeled in extraordinarily productive ways. Many artists, therapists, and helping professionals present borderline characteristics, using their capacity to feel deeply as a work tool. The experience of borderline love in different cultures varies significantly. In more emotionally expressive societies, this form of loving may be more accepted and understood. In more reserved cultures, it may be viewed with suspicion or concern. The concept of splitting, seeing people as completely good or completely bad, is often misunderstood. In borderline love, this manifests as a capacity to see absolute beauty in the loved person, a form of idealization that, although intense, reveals a unique capacity to appreciate the magnificence of the other. Therapists specialized in borderline relationships report that when these people find partners willing to understand their unique way of loving, they can develop relationships of a depth and authenticity rarely seen in other contexts. Research on attachment styles reveals that borderline love frequently arises from early experiences of inconsistent attachment. However, this doesn't diminish its validity or intensity. It only contextualizes its origins and offers paths for greater understanding. The phenomenon of love at first sight is more common in people with borderline characteristics. Their capacity for quick and deep emotional connection allows them to feel intense attraction and affinity in initial encounters, something others may take months to develop. Longitudinal research shows that the intensity of borderline love doesn't necessarily diminish over time, but can become more stable and secure with adequate treatment and understanding partners. It's a transformation, not a loss of the capacity to feel deeply. Couples therapy specialized in borderline dynamics has shown surprising results. When both partners learn to navigate this emotional intensity, they can create relationships of an intimacy and connection that transcend conventional patterns. Studies on neuroplasticity suggest that the borderline brain can learn new ways of processing emotions without losing its fundamental capacity to feel intensely. It's like learning to be a conductor of a naturally potent emotional orchestra. The maternal and paternal experience of people with borderline characteristics reveals another dimension of this capacity to love intensely. Many report a deep and intuitive connection with their children, a form of parental love that transcends the conventional. Borderline love also manifests in how these people relate to pets, to nature, to art. It's a general capacity for intense emotional connection that extends beyond human relationships. But here's the great contradiction that our society prefers to ignore. We label as sick exactly what we secretly envy. How many people live lukewarm relationships, without passion, without intensity, secretly wishing to experience this form of loving that consumes and transforms? The inconvenient truth is that our culture promotes emotional mediocrity. We teach people to control their emotions, to be rational in love, not to give themselves too much. But what if this emotional repression is exactly what's creating an epidemic of superficial and unsatisfying relationships? The mental health system often pathologizes emotional intensity because it's easier to prescribe medications to control symptoms than to teach society to understand and embrace different forms of experiencing love. It's an approach that reduces the richness of human experience to diagnostic categories. The entertainment industry romanticizes obsessive love in movies and music, but when real people experience this intensity, they're quickly labeled as problematic. There's a deep cultural hypocrisy in this contradiction between what we consume as entertainment and what we accept in reality. Research shows that people in relationships with borderline disorder carriers frequently report that, despite difficulties, they experience the most intense and authentic moments of human connection. In their lives, this suggests the problem may not be in the intensity, but in the lack of tools to deal with it. The concept of normal love is, in itself, a social construction that varies drastically between cultures and historical periods. What we consider balanced today may be seen as cold and distant by other cultural perspectives. The medicalization of intense love serves specific economic interests. A society of people who love deeply and connect authentically is less consumerist, less manipulable, less willing to accept superficial relationships as the norm. Longitudinal studies reveal that people with borderline characteristics who receive adequate support frequently develop more satisfying and lasting relationships than the general population. This suggests the problem isn't in them, but in the available support system. If you recognize yourself in this description, know that your capacity to love intensely isn't a defect to be corrected, but a gift to be understood and channeled. Society needs people who feel deeply, who connect authentically, who bring passion and intensity to an increasingly artificial world. The journey isn't about diminishing your intensity, but about finding people and contexts that value and understand it. There are specialized therapists, support groups, partners who don't just tolerate, but celebrate this unique way of loving. The first step is self-compassion. Stop judging yourself for feeling intensely. Your capacity to love deeply is a strength, not a weakness. The world needs more people willing to love truly, not more emotionally anesthetized people. Seek specialized treatment, yes, but not to cure your intensity, but to learn tools that allow you to express it healthily. Dialectical behavioral therapy, developed by someone who also experienced these characteristics, offers practical strategies for navigating this emotional intensity. Surround yourself with people who understand your nature. There are communities, both online and in person, of people who share similar experiences. Isolation makes everything worse. Connection with others who understand your journey can be transformative. Find creative ways to express your emotional intensity. Many artists, writers, and musicians have channeled their borderline characteristics into works that touched millions of people. Your intensity can be a source of creativity and contribution to the world. Remember, in a world that often seems cold and disconnected, people who love with borderline intensity carry a flame that can warm and illuminate others. Your capacity to feel deeply isn't a problem to be solved, but a strength to be celebrated. Develop a solid support network, practice emotional regulation techniques, seek healthy relationships, but never lose your essence. The world needs your intensity, your passion, your unique capacity to love. Arm yourself with knowledge. The truth simply sets you free.